point of view that, you know, I'm trying to raise money and awareness for neurological issues more than just Parkinson's, you know.
And David Walsh joins us on the couch this morning. David, a very warm welcome to you. You were telling me there that you discovered that you first felt symptoms of Parkinson's at 38, but you were only recently diagnosed. Why the 4-year gap?
Well, you know, I'd simplify it to say I'm a man, you know, and I didn't address it. You know, I knew there was something wrong, but I assumed it was mechanical. And I just didn't take care of anything until, you know, obviously recently, to be honed, and that was it.
So you were in the gym when you first got the first twinge, you were saying, because you were a big gym goer.
Yeah, I'd call it a bit more of a twinge. I was doing a particular exercise, lifting quite heavy weights, and I actually thought I dislocated my shoulder, and then it just completely froze out for, I think, about 10 months, to be honest, before it eased up at all. So again, when it started easing up, I just assumed, well, things are getting better, so, you know, I didn't need the trip to the doctor. And of course, different things started coming in, like the tingling in the fingers and, you know, pains in the hips and so on and so forth.
So you were putting it down to the injury, or were you kind of using the injury as an excuse?
You know, I had never really thought about it until now, but you're probably right. It was probably a bit of both, to be honest with you. You know, I think, you know, I knew there was something wrong, and I just refused to address it. I think I was fearful of the fact that it might be something a little bit more serious than what I was hoping it would be, you know.
So what made you decide, look, I better go and get this checked?
Well, you know, I was in my room getting ready for work one evening, and you know, as I said, putting on your trousers, everybody hops around the room on one foot, and I ended up kind of falling over and hitting my head. So I ended up in the A&E in Vincent's Hospital, and they suggested a neurologist, and about 2 months later I saw one, and that was it.
And he gave you the news? He
did, and it was very, very quickly and very abrupt, and took him less than 10 minutes just looking at me. And he just said to me, I'm 99% sure you have Parkinson's, but he said we'll have to do further tests, as in a DAT scan and various other things like that as well.
And how did he know, like, for, you know, in that 10 minutes, was there anything he could really see? That
well, you know, take off your shoes and walk up and down the hall. You know, what seems funny to you, you appear to be drunk without the benefits of having a buzz when you're kind of walking through, you know, a hallway and such. And I think, obviously, he's a neurologist and he specialises in these, and he was trained in and he knew what he was looking for, you know. But I had to remember too that while sitting in the waiting room outside, I'd have to assume there was several other people with the same illness there as well. So, you know.
So when you say you were what, were you stumbling as you walked?
Yeah, it's kind of hard. Your footfalls are kind of, you know, come naturally to you. So you can imagine, you know, heel to toe just walking along. When you lose that ability in one or both of your feet, you shuffle along as such, and then your balance goes, and as you stand up, you get dizzy a lot quicker than, you know, people generally would. You know, just negotiating tight spaces, gaps between people, you're always fearful that somebody's going to move. If you're in a pub or something like that, that somebody's going to move into your way, you know. Prior
to your diagnosis, now you work in a social setup. Yeah. You run a bar in Dublin city centre.
Well, not anymore now. I've taken a back seat.
Okay, you've taken the back seat. Okay, but that's where you were at the time.
Yeah.
What were people saying to you if you were stumbling or falling over, or were they making any comment about your movement?
Oddly enough, very rarely. Like my friends, you know, a lot of them would be kind of rugby players based around Dublin and stuff. You know, I mean, they would have seen me in the gym. I was exceptionally strong and kind of straightforward mechanical movements and such. And I put it down to a damaged shoulder. I just thought I had like a trapped nerve in my spine or something like that. So I played it off as that excuse. And nobody ever really said anything to me because, you know, as I said, I was in the gym 6 days a week, and whatever was causing difficulties at the time were overridden by the fact that I was, you know, particularly strong and
so you were a healthy person. I mean, you had a healthy lifestyle.
Oh yeah, absolutely, yeah. I mean, perhaps a little bit too healthy. And I think when that hit, when I finally got the news, and I stopped going to the gym immediately, and I stopped exercising, and I think things kind of caught up with me very quickly, so I became very unhealthy very quickly as a result. You know?
Did you become depressed?
You know, I'd refer to it as the 30 days of tears, because I remember getting home and I remember locking myself away for about a month. But, you know, after 30 days I said, look, enough is enough. You know, you've got to decide what you're going to do, and, you know, I've decided to do a couple of, you know, charity events, set up a few things, and, you know, do a few things there to raise money and awareness for, you know, not just people with Parkinson's, but people with neurological issues. Because while you mention there's 7,000 people in Ireland with Parkinson's. I think there's 600,000 to 700,000 people suffer from neurological issues in Ireland alone, which is huge, you know.
And has there been anything in your family that
Not that I'm aware of. Not that I'm aware of. I had a cousin in England who died of MS only a couple of years ago, but no, truthfully, my brother-in-law has done a family tree since as well, and I've asked him to add it on that I had Parkinson's, so that in the future, you know, assuming there's not a cure for this, that people will be aware of it in the future. You know?
Speaking of family, how did your friends react when you came and told them I'd been diagnosed with Parkinson's?
Well, I think, you know, they were obviously upset, and I think it was more out of ignorance than anything. I think, you know, as the disease progresses, and, you know, as I was speaking to you earlier about Googling things, I think, you know, initially I did that and it was very dangerous. But I think the more you learn about it, the more you realize that, you know, you're not going to die. And, you know, life changes and you just change with it, and that's it.
Well, how do you feel? I mean, how do you feel sitting here now? I mean, do you have pain or tremors or? Yeah,
there's discomfort. I mean, there's an obvious tremor in me now, but you see, the thing is, you know, again, I'm not an expert, but it's tied in with your central nervous system, I assume, because when I get nervous like now, I start to shake a little bit. Okay. But in saying that, you know, before I was diagnosed, I would have been in my element. I would have sat here and basically owned the set, and that would have been it. But, you know, you find it a little bit more difficult now, but, you know. Yeah,
pains, do you have pains in your, is it your left side you said it's more affected?
Yeah, it's the left side of the body is kind of, in the hip especially, in the shoulder, and I think the electrical kind of shocks down through my neck, which is like somebody honestly sticking hot needles into your neck. And it's not all the time, but it's more discomfort than it is anything else. I think the inability to kind of move freely is, you know, mentally damaging more than anything, you know.
Okay, well, naturally, if somebody is nervous about anything, their hands will shake, or they'll stutter or something like that. Are you purposely holding your fingers together to prevent your hands shaking?
Yeah, well, I'm doing it more out of comfort, to be honest with you. Like, I'll shift. The next position for me would be that I'd sit on my left hand, and, you know, ultimately I'd have to sit on my right hand because it would look a bit odd. Or I might sit with my left shoulder, like, stretched out and holding onto the side of the couch there. And, you know, maybe cross my leg over and pull my ankle up as high as I can, it's just a comfortable position. It's an unusual position, but it's comfortable.
What treatments are you receiving?
Well, I'm seeing a neurologist at the moment, and I'm on medication. Again, you know, I'm not fully aware of the benefits of these meds, but they started me initially on Azilect, and, you know, it actually made me very ill. So they took me off that, and they put me on a drug called Requit Modutab. And, you know, it allegedly takes the edge off things. You know, I'd say maybe it does for somebody else. You know.
You don't look down the tracks and see what's ahead, though. You were saying you don't Google. You read Michael J. Fox's, one of his books, and that kind of turned you off, didn't it?
Well, you know, I read his first book. I think it was Lucky Man or something it was called. It was a friend actually handed it to me. It looked like it was stored in their toilet for, like, you know, 5 years, but they gave it to me and I read it, and, you know, it was very interesting, but I noticed that it was almost a roadmap for illness. I started saying, oh, geez, I had that, and, you know, this will be the next thing that comes, and ultimately these things started creeping in, and I decided not to think that way anymore, you know.
You're being very positive about it, though.
You know, I don't think there's an alternative. I mean, for the first month I wasn't, and, you know, it was woe is me, why is this happening? And but, you know, it doesn't really matter. It's done. The damage is done, and you know, I have a daughter as well who's you know, she's 11, and she can't afford to see me in any other way than, you know, a very positive manner in this, you know.
Is she aware that you have Parkinson's?
She is, yeah. She's fully aware, and, you know, Emily Jade, she's very supportive for an 11-year-old, and she's spot on. I was telling you a funny story about us walking together, and I started shuffling along a little bit, and she started mimicking me, and I said, what are you doing? She goes, I just don't want to leave you behind, you know. So, you know, she's clued in, she knows what's going on, you know.
Okay, well, listen, stay with us on the couch this morning. We'll talk to you a bit more about it. But first, what is Parkinson's? What treatments are available? And where can people go for that treatment? We'll talk to Ireland's leading expert on the disorder after the break, so do stay with us.
Welcome back. Today we're talking about Parkinson's disease. David Walsh told us in the first part of the show how his recent diagnosis is affecting his life, and we'll chat with David a little more in a moment.
We're joined now by Professor Tim Lynch from the Dublin Neurological Institute. Professor Lynch is Ireland's leading expert on Parkinson's disease, and you're very welcome to our show this morning, Professor. Firstly, just a quick question on the age people can get Parkinson's at. I always thought it was a disease that elderly people got until I heard Michael J. Fox got it when he was 30. But you were explaining to me just before we came on air today that you're actually treating someone who was 17 when they came to you, which I didn't know that it could even happen that young.
Yeah, there's a big spectrum, unfortunately. We have one young girl who's now 21 we're looking after, and her onset would have been around 17 or 18. So normally most people would be a little bit older when they get it, but there's a large percentage of people with Parkinson's who get the condition before the age of 65, roughly about a quarter to a third. And then as you go down younger ages, it's rarer, and certainly onset in the teens would be rare, but it can happen. It tends to be more a familial genetic condition at that age, and less so the older you get, but there's quite a spectrum.
So, for the uninformed, what is Parkinson's?
Well, it's unfortunately a progressive neurological condition where you have degeneration of particular cells in the brain that are really important little cells. They're up there producing a chemical in the brain called dopamine. Dopamine is the main fuel for movement. So if you think about when you want to move, let's say you want to walk out the door, you don't stand up and go left, right out the door. You just do it, and you can sort of continue your conversation with the person you're with. To do that, we have automatic systems in the brain that rely on dopamine to function. And what happens in Parkinson's is the cells that produce that dopamine start dying off, and hence you often end up with lack of dopamine. Particularly, it might affect one side of the brain more than the other initially. So you may end up with a frozen shoulder, or tremor, or stiffness and slowness on one side that David would have had, that is progressive in nature. So you end up often with a constellation of things, which would be some slowness, stiffness, tremor. Sometimes the posture gets a bit more round-shouldered, a bit more stooped. Balance can get affected, and then they can get a condition we call freezing, where they stand up to walk, their feet get stuck on the ground and they can't budge them, they're stuck to the ground at the time. And that's all the sort of physical aspects of it. But there's a whole bunch of other things we refer to as the non-motor aspects, which can involve psychological aspects. Mood can go down, initiative, motivation, anxiety can increase. Sitting in front of you folks answering questions can be more stressful than other times, whereas you would have handled it better before. You can get lots of other things like lightheadedness, good old constipation is common, etc., etc., etc. So there's a constellation of things that can occur with it, all because you're sort of dropping down your dopamine levels in the brain, which is a critical neurochemical for brain function.
It sounds like a lot of kind of symptoms. Do GPs pick it up quite readily? I mean, or can it go undetected for a long time?
It can go undetected, and I suppose the age of onset aided presentation can give you a sort of curved ball in some fashion, because if you're seeing someone in their late 30s with a frozen shoulder and slowness, you don't think Parkinson's. You think, well, they damaged their shoulder weightlifting, and that may have an injured shoulder that might need sort of therapy that way. But, you know, the penny drops as you watch somebody over time, and sometimes it's difficult for all of us. I'll see some patients I see and say, well, I'm not sure. And I want to see them in follow-up maybe 6 months or 9 months or a year down the road and compare my assessment from one time to the next, because sometimes it can be subtle and there are mimics to it. There's other things that give you tremor. For example, there's a familial form of tremor, the one that Katharine Hepburn, if you remember Katharine Hepburn in the movies, she was quite shaky, and she had a shaky voice in her head, and she had what we call benign essential tremor. But that can sometimes look like the tremor of Parkinson's and needs to be teased out to try and distinguish the two.
So what treatments are there? We heard that David telling us about 2 forms of medication, one that made him ill, another one that he seems to be coping with a little bit better.
Sure. Well, I suppose the first thing I often do is I see somebody with Parkinson's start with is to make a clear diagnosis to start with, and then discuss it with them. And I suppose they say they get good attitude, and David seems to have good attitude, I have to say, in that understanding your condition, know the devil you're dealing with, and understand what's going on. They make a decision what you want to do in life, get on with it, be proactive about it as he's doing, looking at diet, looking at exercise, looking at good sleep, all that sort of stuff. And then second level, after you've got through all that, including exercise and the psychology of it, is you might want medication, but that depends on the person. If you're a CEO of a company and you've got a bad rest tremor that's annoying you when you stand up to talk, you may want specific treatments to try and deal with the rest tremor. Fair enough. That can be hard to treat. But then again, if you're not a CEO and you don't care about the rest tremor, it's not interfering with your quality of life, well, where you go, you may not need specific medications. So we sometimes use medications initially, and sometimes may hold off, depending on the person's need. There's a debate ongoing, though, whether some of these pills might actually put a brake on the condition. Would they sort of prevent progression? And that's a debated topic. David mentioned the first pill, Azilect. There's a debate about that, and it may or may not do. So it depends on the individual, and I suppose we sort of cut the cloth to suit the person. And that debate happens initially, and often the patient may come back a second time for subsequent discussion, having got used to the concept of having Parkinson's, which isn't easy. So that 30 days is not a very long time, frankly. Other people may have quite a while of denial. Why me? What's up? Why is it happening? And all that sort of frustrations associated with that. And then at that stage, in the second assessment, you may want to try specific medications